There's a number that may do more to predict how long you live independently than your blood pressure, your cholesterol, or your fasting glucose. Most people have never heard of it. Most doctors don't measure it in a routine checkup. It is called VO2 max. It is simply a measure of how much oxygen your heart, lungs, and muscles can use when they are working hard. You don't need a lab to start improving it. A brisk daily walk is enough to begin. Today, we are going to explain what this number means, why it matters so much after 60, and exactly how to start building it safely, gradually, and without a gym. A 2018 study from the Cleveland Clinic followed more than 122,000 adults and tracked their cardiorespiratory fitness alongside traditional risk factors, things like high blood pressure, diabetes, and smoking history. The finding was striking. Low cardiorespiratory fitness was a stronger predictor of early death than any of those traditional risk factors. And here is the part worth holding on to. There was no upper limit of benefit. The fitter people were, the lower their risk, all the way to the top of the fitness range. Separate research found that each meaningful step up in aerobic fitness was associated with roughly a 13 to 15% reduction in all-cause mortality risk. Those are not small numbers. But the reason this matters so directly for older adults goes beyond mortality statistics. Research suggests there is a threshold, a fitness level below which everyday tasks become genuinely difficult. Climbing a flight of stairs, carrying groceries, getting up from a low chair. A sedentary person can cross that threshold in their 70s without ever realizing they were approaching it. Those are the real stakes of this conversation, not athletic performance, independence. Here is the honest part. Aerobic capacity does decline with age. In sedentary adults, it falls roughly 10% per decade starting in your 30s. Active adults lose only about half that, closer to 5% per decade. That gap is not trivial. It represents years of functional independence. And here is what makes this genuinely encouraging. A meta-analysis of 41 controlled trials involving more than 2,100 sedentary older adults, average age 60 or above, found that endurance training produced an average VO2 max improvement of more than 16%. A 2024 systematic review of 38 randomized controlled trials confirmed that aerobic training improved cardiorespiratory fitness across all age groups, including adults over 65 and regardless of existing health status. A separate study looked specifically at adults averaging 80 years old. After an aerobic training program, they improved their maximal oxygen consumption by 13%, to the same extent as younger comparison participants. The capacity to adapt does not disappear. It slows, but it stays. Beyond the heart and lungs, there is a cognitive benefit worth mentioning. A meta-analysis of 10 randomized trials found that aerobic exercise significantly improved global cognitive scores in older adults with mild cognitive impairment. A separate federally funded trial found that the effect on executive function, the kind of thinking used for planning, decision-making, and staying organized, grew more pronounced with age. That is an important finding for anyone who wants to stay mentally sharp alongside staying physically able. The research supporting these benefits consistently points to one intensity level, moderate, not a stroll, not a sprint, moderate. Here is the simplest way to find it. While you are moving, try to say a full sentence out loud. If you can speak comfortably, but you would not be able to carry a tune, that is moderate intensity. You're working, but you're not gasping. If you prefer a number, moderate intensity corresponds roughly to 60 to 70% of your maximum heart rate. A simple estimate of your maximum is 220 minus your age. So for a 70-year-old, that is a target range of roughly 90 to 105 beats per minute. For those on certain heart medications, beta blockers in particular, heart rate is not a reliable guide. Use the talk test instead and check with your prescribing doctor about appropriate targets. The WHO recommends 150 to 300 minutes of moderate intensity aerobic activity per week for adults. The American College of Sports Medicine echoes that. If that sounds like a lot, consider this. 3 10-minute brisk walks across the day count toward your total. You do not need to find a single 30-minute block. Brisk walking, cycling, swimming, water aerobics, and the elliptical are all good options. They are low impact, require minimal equipment, and suit a wide range of joint and mobility situations. If you've been largely sedentary, the right starting point is not 30 minutes. It is 5 or 10 minutes of easy walking most days. Every 1 to 2 weeks, add about 5 minutes. Work toward 30-minute sessions over 6 to 8 weeks. Build time first, then frequency, then intensity, in that order. This approach keeps soreness and injury risk low and makes the habit sustainable. Within 4 to 8 weeks of consistent moderate activity, most people notice real changes. Resting heart rate tends to drop. Everyday tasks feel a little easier. Energy levels improve. The fitness metrics themselves, measurable VO2 max gains, typically show up after 12 to 20 weeks. A few safety notes. Most apparently healthy older adults can begin moderate intensity walking without a prior medical exam. But if you have unstable heart disease, uncontrolled heart failure, or certain other active cardiac conditions, please speak with your doctor before starting. If you have controlled high blood pressure, type 2 diabetes, or a history of a cardiac event, discuss your plan with your physician. The most recent American Heart Association and ACC guidelines actively encourage regular physical activity for people with stable, controlled cardiovascular disease. There are supervised cardiac rehabilitation programs designed exactly for that situation. Stop and rest, and seek care if needed. If you experience chest pain or pressure, severe shortness of breath, dizziness, near fainting, or pain that radiates to your arm or jaw, those are signals to stop activity and contact a healthcare provider or call emergency services. And as always, this video is educational. It is not a substitute for advice from your own doctor or healthcare provider. Your aerobic engine is not fixed. It responds to what you ask of it, at 60, at 70, at 80. A brisk walk, done most days, at a pace where you can talk but not sing, is enough to begin shifting the numbers that matter most for how long and how independently you live. That is a straightforward thing to do, and the evidence behind it is some of the strongest in all of longevity research. If this kind of practical, evidence-grounded content is useful to you, we would love for you to subscribe. We publish videos regularly on the topics that matter most to adults over 55 and the family members who care about them. No hype, just the research, explained plainly. We will see you in the next one.